And while the social determinants of health are critical for us to keep in mind, I think what we really need to be focusing on are vital conditions for health,
Okay.
because those things that negatively affect a person's ability to live and thrive certainly need to be addressed. They are by and large systemic, and we
Mhm.
can't put the onus on the person. If we look at vital conditions and it's housing and it's honorable and decent work with the person, the capacity of the person to, have money, it's social involvement and civic engagement. And it is all of the things that make it possible for someone to thrive. That is where I think I need to put my energy, because some of the structures that are resulting in these negative social determinants, I'm not sure I know how to affect. But in my own communities, working with organizations that are trying to dedicate themselves to outreach for solutions around housing or work or civic engagement, those are the kinds of connections that I want to foster, because then what I'm doing is I'm doing my best to lift somebody up according to what might be of benefit to them. One of the things that I learned over time, particularly because I was focused on infectious disease, I was focused on tuberculosis earlier in my career, is that I was really focused on someone's vulnerability.
Huh.
Oh my gosh, they're not going to be able to access, they're going to need their medication. They're not going to be able to, stay in one place. We need to be able to help them move. But the person that I was concerned with was focused on opportunities. What's going to be best for my family? Where am I likely to have good work? Where can I find housing?
Mm.
And so they were focused outward on what was going to be propelling them. And I was focused downward as if they were incapable. And I found myself really at lockhead with people because they were not focused on what they couldn't do. They were focused on what they could and where they could do it. And so I see that those of us who are helping, who are purporting to be in alignment with the needs of others, frequently get so involved ourselves in what's happening and what it is sort of costing us, either emotionally or politically. We have to call in all of our chits to get something to happen, are then not in sync with the individual with whom we're trying to support. So the vital conditions for thriving, for healthy individuals, is really where I'm focusing my attention.
Mhm.
Where I can have systemic impact, then that's what I'm trying to do. If there is a policy, if there is a governmental structure, if there is a regional structure that I can engage in to ask them to modify their processes, I certainly want to do that because I have the skills and I have the ability to engage in large scale negotiations and conversations. But really, the everyday of what somebody needs to thrive has to be where I put my best energy.